told you yesterday, we had the single largest Monday in number of cases ever. Today, we have the single highest Tuesday with 1,786 new cases of COVID-19. That is 1,786 Kentuckians and their families that are worried about their health right now. And that's 1,786 Kentuckians, that some portion of which will end up in the hospital, will end up in the ICU, and will end up not making it. It is our duty as Americans, as Kentuckians, as good people of values and faith to come together once again to fight this virus. None of us a year from now, when we are in an old normal, a new normal, when we are beyond COVID, because I think we most certainly will be, want to look back and say, if we just cared a little bit more, what could have been. We continue to see increases in our hospitalization, with 913 Kentuckians currently in a hospital bed because of COVID. We have 233 Kentuckians in the ICU fighting for their lives, and 115 Kentuckians currently on a ventilator. Those numbers aren't going the right direction, but as long as cases are increasing at the rate they are, they're going to continue to increase as well. COVID positivity rate 5.97% today, the highest certainly in a long time. New cases by county. It's going to take a bit for me to read all of those in double digits, because when we have this many cases, it means we are having escalations in just about every county. Jefferson, 379 new cases. Fayette, 118. Warren, 68. Kenton, 60. Hardin, 49. Pike, 45. Barron, Laurel, and Madison, 42. Boone, 41. Bullitt, 40. Campbell and Nelson, 36. Clay and LaRue, 24. Hart, 23. Davis, 22. Lee, 21. Callaway and Logan, both with 20. Floyd, 19. 18 for Christian and Whitley. 16 for Jessamine, Johnson, Knox, Marion, and McCracken. 14 for Garrett, Henderson, Montgomery, and Todd. 13 for Clark, Hancock, Martin, and Rockcastle. 12 for Boyd, Grant, Perry, Shelby. 11 for Estill, Lincoln, Monroe, Scott, and 10 for Carter, Franklin, Graves, and Ohio. That list is far longer than any one we want to read. Again, that says we all have a lot of work to do. And if I read the name of your community, and your community is going red or going to be red, and we'll talk about this Thursday as the date that we look at that map, then you got a job to do, just like I do. And that job is to do what it takes to defeat COVID-19, to cut down on your contacts, to spend that next week differently, knowing that it has gotten dangerous enough to where for that period of time we need to alter our day-to-day lives to make sure we can protect those around us. And if you want to know the seriousness of it, which you would think that 1,786 cases, 913 people in the hospital, and 233 in the ICU because of COVID was enough, we have 18 additional deaths today. And every single one of these deaths occurred in October. We have a 99-year-old woman from Christian, which we lost, a 79-year-old man from Henderson, a 79-year-old woman from Henderson, a 70-year-old woman from Hopkins, an 86-year-old woman and a 62-year-old man from Jefferson, an 82-year-old woman and a 93-year-old man from Jefferson, a 62 and a 70-year-old man from Jefferson, a 79-year-old female from Jefferson, an 87-year-old male from Jefferson. A hard day for Jefferson County. We have two 96-year-old men from Jessamine County, a 76-year-old man from Nicholas County, a 72-year-old man from Ohio County, 91-year-old woman from Scott County, 77-year-old woman from Scott County, and a 72-year-old woman from Taylor County. 18 additional Kentuckians. And you can see the numbers that we lose pick up as our cases pick up. And sadly, I think we will see these numbers grow even higher. So we got work to do. But let's also remember that it's our job to honor those that we've lost and to support their families. So if you haven't been lighting your home up green, why don't we start doing it again? If we haven't been ringing bells at 10 a.m. in the morning, why don't we do it again? Because you never know who's out there and who it might help on that given day. We have more COVID now than ever before, and we need more support for those that are going through hard times or those who have lost than ever before. This week could be even worse than last week, so we need your help. Long-term care facilities continue to get hit. When we have so much virus, a community is red, it's going to get in that facility, even with everything we do. So protecting the most vulnerable is also about lowering cases in our community. So 57 new residents and 33 new staff members that are positive, 8 new deaths attributable to long-term care residents. The number of facilities is the same. Daycare, 10 new facilities with at least one positive case, 8 new staff, and 10 new children.